What's going on, world? Welcome. Hey, you guys already know what we're doing today. We're doing NCLEX questions. Today is Wednesday. Sorry if you guys missed me on Monday, but hey, Nurse Daddy K had to go be daddy because my son was sick, so we had to take care of all that. If you guys are new here, welcome. We are doing NCLEX questions. You guys already know what I want. I need 100 people in here and I need 1,000 likes. There's no ifs, ands, or buts, but I need them both. So make it happen, all right? So make sure you guys keep smashing that like button. If you guys are new here, welcome. My name is Kevin. I go by the Boot Nurse on all social media platforms. You guys can check me out over there. Hey, so since we don't know what the stake of what TikTok has going on, make sure you guys go over there and follow me on YouTube. You guys go follow me on Instagram. Everything is at the Boot Nurse. You guys can go over there and check that out, okay? But of course, what I want to know is who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse hanging out, what are you doing with your life? Hopefully everybody is really great. Had a great week. Sorry if I missed you guys on Monday. Kate, what's up? Hey, anybody that wants to do the paramedic life, go holler at my girl, Kate. All right. Kate will get you right. Somebody said I had a question. What was your question? Geraldine, I see you. Hey, Geraldine is a frequent flyer. She messages me all the time being like, hey, are you okay? I didn't see you live. And I'm just like, hey, we good. And I appreciate you. You're the only one that does that, Geraldine. So I appreciate you. All right. So what are we thinking? By the way, I want to know who you are, where you're from. Alexis says, I'm in my second semester of RN school. Shout out to you, Lexi. Thumbs up to Geraldine. Hey, we got 50 something people up in here. We got 400 likes. Hey, 1,000 likes, and 100 people. I'm just saying, you got 78 people in here. Y'all ain't trying to get carpal tunnel. What are we doing? Hopefully everybody, like I said, had a good week. Hey, don't be scared about this whole TikTok thing. What's up, future? Hey, let them know. Hey, if y'all don't know who Nurse Glamber is, Miss Amber over there, another NCLEX strategist. Hey, she will get you right as well. I think she just had, Amber, correct me if I'm wrong, if you just had something go on where you did a free class on NCLEX questions. If y'all aren't following Amber, Nurse Glamber, NCLEX strategist on TikTok, but more importantly on like other platforms like Instagram, make sure you guys go over there and check her out. Yeah, I knew she did. Shout out to all 141 of y'all. We're about to do we're about to do NCLEX questions as soon as I get 1,000 likes. And there it is. There it is, baby. Hey, you guys already know what the deal is. We're going to do NCLEX questions. So shout out to everybody that's here. Well, without further ado, here we go. Question number 1. Nurse EJ is assigned to telephone triage. All right. A client called who was stung by a honeybee and is asking for help. The client reports pain and localized swelling, but has no respiratory distress or other symptoms of anaphylactic shock. What is the appropriate initial action? The appropriate initial action that the nurse should direct the client to perform. Is it to remove the stinger by scraping it, applying cold compress, taking an oral antihistamine, or calling 911? What are we thinking? Shout out to all 200 plus y'all. Hey, we're on the road to 10,000 likes. If I don't have 10,000 likes, by the time we get to question 10, my throat's going to hurt on some Monique-ish. Just letting y'all know. By the way, I got these questions off nurseslabs.com. Specifically, we're talking about emergency nursing right now. That's what we're talking about. And these are both for RNs and LPNs. Hold on 1 second. Let me bring this down some. Hey, if you guys are new here, welcome. We're doing NCLEX questions. I want to know who you are and where you're from, where you're at in your nursing journey. Don't be shy. Don't y'all be shy. Here we go. Here's our answer in 3, 2. And the answer is A, remove the stinger by scraping it. Since the stinger will continue to release venom into the skin, removing the stinger should be the first action that the nurse should direct to the client. Within the first few minutes after the stinger should be removed via scraping with a credit card, rather than the tweezers to avoid further venom exposure. Okay. Now, once again, these are all part of emergency medicine or emergency nursing and triage, right? From nurseslabs.com. Hold on. Isaac said, just passed my NCLEX 2 days ago. Isaac, shout out to you. Isaac, you are number 1. Congratulations, sir. Congratulations. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give to everybody here taking their NCLEX, sir, what would it be? And once again, congratulations to you. All right, here we go. Shout out to everybody that got that question right. On to the next one. All right, here we go. Question Number 2, Nurse Anna is an experienced travel nurse who was recently employed and is assigned to the emergency unit. In her first week of the job, which of the following areas is the most appropriate assignment for her? Is it triage, ambulatory section, trauma, or psych care? What are we thinking? What are we thinking? Kate is telling me A. Kate, you can't answer. You work in the ER. You can't answer. Shout out to all 260 of y'all out here rocking. We're doing NCLEX questions. We're on the road to 10,000 likes. So that means I need to have 10,000 likes before I get to question 10. If I don't, all of a sudden, I'm not going to know how to read. And there may be a glitch on TikTok. I'm just saying. And also make sure you guys like, share, and follow. If you guys are in nursing school right now, if you're in nursing school right now and you haven't shared this with your cohort, what are you doing? All right. I know y'all are in Kahoots or whatever little app y'all are in. Share it to them. I don't care how you feel about them. Just share it to them. I need them. All right. Here we go. Here's our answer in 3, 2. And the answer is B. It is ambulatory section. The ambulatory section deals with clients who with relatively stable conditions. The decision of whether or not to delegate or assign is based upon the RN's judgment concerning the conditions of the patient, the competence of all members of the nursing team, and the degree of supervision that will be required of the RN if a task is delegated. All right, let's go, Estelle. I see you out there. So, once again, these are from emergency medicine, right? Emergency nursing and triage, right? Nika says, good afternoon. Kevin, I passed my NCLEX. Thank you so much for your help. Hey, Nika, Nika's number 2. Nika, congratulations. Welcome to the greatest shit show on earth, known as being a nurse. Whether you're an RN or an LPN, if there's a piece of advice that you could give to everybody out here, what would it be? And ma'am, of course, congratulations to you. Jan says this is easy. I didn't ask you if it was easy. I asked you to answer the question. So, and it may be easy to you, but there are other people in here who don't know. And if it was easy, it would be 100%. So, got to realize we got to meet people where they are. All right. Donnie says, hey, Kevin, just wanted to say I take my test tomorrow and want to say thank you for your help. Donnie, you are welcome, my good sir. You know better not to be on here to be trying to cram. So I appreciate you being here. Hey, come back on Friday and let us know. Let us know how you do. All right. But hey, good luck to you. Go and relax. Here we go. Question number 3. A client arrives at the emergency department who suffers multiple injuries from a head-on collision. Which of the following assessment should take the highest priority to take? Is it unequal pupils, irregular pupils, ecchymosis in the flank area, or a deviated trachea? What are we thinking? Kate, didn't I tell you that you can't answer? Didn't we talk about that already? Hey, if you guys are rocking with me, welcome. We're doing NCLEX questions. I got them off nurseslabs.com. Free sets of questions. You guys can go over there and check those out for yourself. But of course, I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? Deviated trachea, ABCs? Pneumo. Actually, it's D. What's up, Queen Mindy? How are you? Day says, pass my NCLEX and 85 questions. Like you passed recently, Day? You got to give me more context than that. You could have passed your NCLEX 4 years ago. I mean, shout out to you. But here we go. Here's our answer, y'all. Here is our answer in 3, 2. Whitney says, just completed my bachelor's 17 years in nursing here in South Carolina. Shout out to you. Oh, Whitney, were you an associate's degree nurse? Doesn't matter. Congratulations to you regardless, right? But the answer is D, a deviated trachea. A deviated trachea is a symptom of attention pneumo, which will result in respiratory distress if left untreated. The first question of the ESI triage algorithm for triage nurses asks whether the patient requires immediate life-saving interventions or simply is the patient dying. Kate, you can agree with that. The nurse determines this by looking to see if the patient has a patent airway, if the patient is breathing, and does the patient have a pulse. Emergency medicine. All right, that's physiological adaptation, which is also a part. This could go to physiological adaptation as well as management of care. Okay, so shout out to everybody that got this question right. But then we're honing in on the emergency medicine aspect. So shout out to everybody that got that question right. All right, last semester in ADN, that's what I'm talking about. All right, here we go. Question number 4. Nurse Kelly, a triage nurse, encountered a client who complained of mid-sternal chest pain, dizziness, and diaphoresis. Which of the following nursing actions should take priority? Is it administer oxygen therapy via nasal cannula? Notify the provider. Complete history taken. Or is it to place the client on an ECG monitor? Taking my boards on Friday. Shout out to you, Des. Is that short for Destiny? EMJ says, I'm a rad tech and I'm just quizzing myself about the stuff. Hey, is it EMJ? Hey, that's cool. That's cool. Come over here and test yourself out. That's all good. Hey, if you guys are new here, and if you guys don't know about me, my name is Kevin. I've been a nurse for 3.5 years. I've worked ICU, OR, and PACU. Also, I did 16 years in the Navy. I just got out in January of this past year. And I have an extensive teaching background for the last 9 years. So I love being here. Mostly it's because, no institution of higher learning ever wanted to hire me. So I have to come here and teach y'all. But I love it. So shout out to y'all. But the answer is A, administer oxygen therapy via nasal cannula. Via nasal cannula. The priority goal, remember to RTFQ. Do you have an ASN or BSN? Doesn't matter. It doesn't matter which one you have, but I have a BSN. The priority goal is to increase myocardial oxygenation. All right. You took your NCLEX yesterday. It's all good. I know that you killed it. Place the client or the patient on a cardiac monitor. Establish intravascular access. You want to give the chewable aspirin, clopidogrel, ticagrelor, control pain, and consider oxygen therapy. All right. A lot of people are thinking about Mona, right? Listen. Mona can set things up for you, but based off of what the question is asking you, will determine which part of Mona you will go. If you went off of Mona, you would have given morphine, but morphine's not an answer. This is not ATI. All right. So you got to RTFQ. Y'all let me know what RTFQ means inside of the chat. Doesn't matter. I'll tell you. It means read the fucking question. Read it. Ladies and gentlemen, it's a priority question. That's a management of care type of question. All right. Don't know how I came across your page, but I'm enjoying it. I take my NCLEX in a week. Shout out to you, Div. Shout out to you. Melissa, you must be new here. I'm just saying. Question number 5. It says, what's EKG in the real world? All right. Well, we're not asking, Kelsey, we're not asking about the real world. We're not asking about the real world. We're asking about this. All right. Question number 5. Kelsey, I think you said something about you were a nurse for a while, but, a group of people arrived to the emergency unit by a private car with complaints of periorbital swelling, cough, and tightness in the throat. There is a strong odor emanating from their clothes. They report exposure to a gas bomb that was set off in their house. What is the priority action? All right. So what is who takes priority? What is the most priority action when it comes to somebody with a type of biological, radiological, type of issue that's going on, right? Instruct the personnel to don personal PPE. Direct the client to the cold or clean zone for immediate treatment. Immediately remove other clients and visitors from the area. Measure vital signs and auscultate lung sounds, or direct the client to the decon area. What are we thinking? Shout out to all 295 y'all out here rocking. We're doing NCLEX questions. I got them off nurseslabs.com. These are both for RNs and PNs, and you guys can go over there and check those out for yourself. Hey, we're on the road to 10,000 likes. If I don't have 10,000 likes by the time I get to question 10, I'm going to pull a Monique. And my throat will hurt. I'm just saying. So y'all better make it happen. You know what I'm saying? What are we thinking? Nope, this is not a select all that apply. What are we thinking? All right, well, let's see what these answers are. Let's see what the answer is, not what the answers are, because it doesn't say select all that apply. All right, here we go. In 3, 2, and the answer is E. Direct the client to the decontamination area. Decontamination is a specified area, or in a specified area is the priority. The decontamination and support area are established within the warm zone, also referred to as the contamination reduction zone. Decontamination involves thorough washing to remove the contaminants. Hey, you got to protect yourself first. Because the last thing you want is somebody with all their gassy nastiness coming into your emergency department and contaminating everybody inside of the trauma bay to the ER itself, and see how fast things spread. Okay, so make sure you guys pay attention to that. Shout out to all y'all that got that question right. Yep, you got to put me first. Ladies and gentlemen, real quick. Hey, if you guys are new here, or if you're not, hey, I have a PDF, a free one that you guys can check out. Test taking tips to help you conquer the NCLEX. It's a free download over there at my website, thebootnurse.com/test. 42 pages of greatness that you guys can check out for yourself. All right. You guys can check that link out in my bio, or you guys can go check it out at thebootnurse.com/test. It's a free download. So make sure you guys go over there and look at that and keep getting your learn on. Hey, we're almost to NCLEX, the height of NCLEX season. All right. People about to start graduating. So, hey, be prepared. Okay. Here we go. Question number 6. When an unexpected death occurs in the emergency department, which task is most appropriate to delegate to a nursing assistant? So this would be your UAP, or unlicensed assistive personnel, okay? Assisting with postmortem care, facilitate meetings between the family and the organ donor specialist, escorting the family to a place of privacy, or help the family to collect belongings. What are we thinking? What are we thinking? Shout out to everybody. Shout out to y'all. Shout out to y'all. We're doing NCLEX questions. But of course, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you guys got to share, you guys got to follow, and you guys got to like, because that's the trifecta. I need to be on the For You page. You know what I'm saying? For you. You know what I'm saying? I took my NCLEX yesterday. Shout out to you, Lace. I'm pretty sure you killed it. Hey, you come back on Friday and let us know how you did. Or send me a DM and let me know how you did. Mississippi failed twice. Need help? Hey, if you need help, check out my link tree inside of my bio. All right, but the answer is A, assisting with postmortem care. Postmortem care requires some turning, cleaning, lifting, and so on, and the nursing assistant is able to assist with these duties. The use of an NAP, or nursing assisted personnel, increasingly demands registered nurses to delegate patient care tasks according to the principles of the ANA. These principles define nursing delegation as the transfer of responsibility for the performance of an activity from one individual to another while retaining accountability for the outcome. So, hey, if you're going to be a registered nurse, just know you delegate a task to somebody. You delegate a task to somebody, and if they don't do it, guess what? You're still responsible if they don't do it. Just saying. So you guys got to be aware of that. Make sure you guys task people with the right things that are within their scope of practice. All right. Here we go. Question number 7. The physician has ordered cooling measures for a child with a fever who is likely to be discharged when the temperature comes down. Which task would be appropriate to delegate to the nursing assistant? Is it prepare and administer a tepid sponge bath? Is it to explain the need for giving cool fluids, assist the client in removing outer clothing, or assist the parent advise the parent to use acetaminophen instead of aspirin? What are we thinking? All right, now think about it. The nursing assistant, or the UAP, what is their scope of practice? What can they do? What can they not do? So let's reread it. Can the nursing assistant prepare and administer a tepid bath? Can they explain the need for a cooling fluid, or to give cooling fluids? Can a nursing assistant assist a child in removing outer clothing? Or can a nursing assistant advise the parents to use acetaminophen instead of aspirin? All right. Sometimes you have to reread it to yourself that way. It's got to be C. Well, we got to figure it out. All right, y'all. Here we go. Here's our answer in 3, 2, and the answer indeed is C. Assist the child in removing outer clothing. The nursing assistant can help with the removal of outer clothing, which allows the heat to dissipate from the child's skin. The client is the center of care. The needs of the client must be competently met with the knowledge, skills, and ability of the staff to meet their needs. All right, so this is, once again, we're talking about more delegation. That's a management of care type of question under the emergency nursing aspect, okay? So remember, if you got it wrong, you need to read your rationales. You need to RTFR. Who can guess on what RTFR stands for? Just saying. Y'all let me know. Who can guess? All right. So remember, you got to read your questions, read your answers, read your rationales. OK. And if you don't get it, circle back. Go back to basic care and comfort. Go back to leadership. Go back to your management content. Right. It says don't delegate what you can't eat. There you go. There you go. Yeah, read the effing question. Y'all are wild out here. Laura, that's exactly what it means. That's exactly what it means. You picking up what's RTFR? Psh, hey, J-Ban, you best pay attention, my guy. You best pay attention. It says new to your page, ER nurse, been one for 8 years, working CVICU prison, now ER. Oh, Kelsey, so you ready? So Kelsey essentially likes to fight people, y'all. I'm just letting y'all know. No, J-Ban, you're good, bro. You're good. But here we go. Question number 8. Read the flipping question. Brittany, whatever you got to say to yourself, that's fine. Question number 8. You are preparing a child for IV conscious sedation before the repair of a facial laceration. What information should you report immediately to the physician? Lord have mercy, I can't talk today. Is it A, The child suddenly pulls out the IV? Is it B, the parent is not sure regarding the child's tetanus immunization status? Is it C, the parent wants information about the IV conscious sedation? Or is it D, the parent's refusal of the administration of the IV sedation? What are we thinking? What are we thinking? Imagine being in the ER and trying to do, sutures on a child. Good luck. Saying, think about that. Sometimes you got to put yourself in those shoes. Hey, if you guys are new here and rocking with us, welcome. We are doing NCLEX questions. And it's a nightmare. Kelsey knows what's up. It's a nightmare messing with kids, right? Especially if you work a pediatric, ER, pediatric, anything. All right, here we go. Here's our answer, ladies and gentlemen. Here's our answer in 3, 2. And the answer is D, the parent's refusal of the administration of the IV sedation. The refusal of the parents is an absolute contraindication. Therefore, the physician must be notified. But the autonomy of parents is very obviously different from the autonomy of the patient to make decisions for themselves. While adult parents are generally thought to have absolute rights to refuse medical treatment for themselves, we don't usually think that parents can refuse all medical treatments for their child. Now, there's a lot of back and forth that happens in emergency rooms, especially when it comes to consent and all those things. But you got to think, a consent form is good all the way up until I decide that it's not, as the patient. All right, Juliana, I know you killed that exam. All right. So I've literally seen parents or even family members that are just like, yeah, that's good to go. And then all of a sudden they're like, no, I don't want to do that. Right. But when it comes to children, it's very, very different. There will be a lot of ethics and a lot of legal people that'll get called, and a judge will actually sign and say like, no, this child needs to have this, to make sure that they're comfortable. So like, judges can overrule parents when parents are not in their right mind to make decisions for their children. All right. Just saying. It's a big, big deal. All right. Here we go. Question number 9. The emergency medical service has transferred a client with severe chest pain. As the client is being transferred to the emergency stretcher, you note unresponsiveness, cessation of breathing, which is the breathing has stopped, and an unpalpable pulse. Which of the following tasks is appropriate to delegate to the UAP or the nursing assistant? Is it assisting with the intubation, placing the defib pads, doing chest compressions, or initiating back valve mask ventilation? What are we thinking? Who just screamed at me? Who screamed at me? Oh, it was Brittany screaming at me? No, you're good. Shout out to all 300 plus y'all. We're over here doing NCLEX questions. All right. Doing NCLEX questions both for RNs and LPNs. These are from nurseslabs.com. So make sure you guys like, you guys share, you guys follow. If you guys follow me, hit that notification button so you guys know when I go live. I go live Monday, Wednesdays, and Fridays at 5:30 Central Standard Time. And if you're not in the United States, just look at wherever Texas is at, and that's the time I fall under. So there you go. But let us see what the answer is. Let us see what the answer is in 3, 2. And the answer is C, doing chest compressions. Performing chest compressions are within the training of a nurse assistant. Every good certified nursing assistant should be proficient in CPR. BLS certification is the widely used term for any form of CPR certification and is required for all registered nurses and certified nursing assistants as well as LPNs. Everybody is BLS certified. Everybody. But not everybody is ACLS certified, right? Or PALS or anything like that, depending, or TNCC. It all just depends on where you work at. All right. So, hey, who said that? J-Ban says we need some hard questions, my boy. Hey, they may be hard. They may not be hard for you. All right. And like I said, these are questions that are free on the internet that anybody can go and look up for themselves. All right. So there's that. I'm giving you what I pulled off of there. And so it was a nice random one. So, you got to get your learn on some way, shape, or form. Here we go. Question number 10. The nurse manager decides to form a committee to address the issues of violence against ED personnel. Which combination of employees would be best suited to fulfill this assignment? All right. Which one would it be? Would it be the ED physician and charge nurses, LPNs, RNs, and nursing assistants, experienced RNs and experienced paramedics, or at least one representative from each group of the ED? What are we thinking? Shout out to all 300 of y'all. Hey, by the way, something that y'all don't know about me. I failed my NCLEX 3 times, y'all. 3. Not once, not twice, 3 times. Shocking, right? So I failed my NCLEX 3 times, y'all. And none of y'all that are new here would have ever known that unless I opened up my mouth and just told y'all that. You want to know why? It's because it doesn't matter. Your opinion of me failing doesn't matter. Me failing my NCLEX doesn't matter. My job never asked me how many times I failed it. My patient never asked me how many times I failed it. So guess what? If you are scared to take the NCLEX, hey, get out of your own way. If you're scared, go to church. Go pray to whoever you need to pray to. And then you need to put that work in. So you can go back and do round 1, round 2, round 3. Nursing is an ongoing learning experience. 100% it is. You learn how to become a nurse when you work as a nurse. I'm trying to tell you right now. You needed to hear that. That's what I'm trying to tell y'all. I've been a nurse for almost 4 years, and no one cares. No one cares. No one's going to be all up in your face at saying, oh, you failed. And by the way, if you have anybody that comes up into your face and they start being real derogatory towards you, telling you that you don't deserve to be a nurse or find a different profession, hey, you can kindly and respectfully tell them to fuck off. I'm just saying. There you go. Get off the beach. That's why I say get off your beach. But the answer is D. At least one representative from each group of ED personnel. At least one representative from each group of the ED personnel should be included because all employees are potential targets for violence in the emergency department. The diversity of the group should also be considered and assured that each department or each employee is represented. All right. Hey, so shout out to y'all. I'm just letting y'all know. This is what drove me. This is what drove me to start doing stuff online and start to let y'all know that it's okay. It's okay for you to fail. Trust and believe me. It's okay for you to fail. What do they call you at the bottom of your cohort? Nurse. That's it. And ladies and gentlemen, speaking of that, I actually tell a story talking about how I went through my journey of conquering the NCLEX. Right now, I have a book you can pre-order. It's called Conquer It, The Journey to Passing the NCLEX. Why? Because it speaks to those individuals who are either going to take it once or who are going to take it more than once. Because guess what? I've sat in both of those because I've done it multiple times. So you got to get off your beach. You got to get out of your own way. If you ever want to do anything successful, you got to push through the gunfire. You got to push through all the hate. You got to push through the world in order for you to progress. All right. So you guys can check that out. That link is also in my bio on my link tree, but it's bootnurse.com/books. And you guys can go over there and check it out. And it's on Amazon. You can pre-order it right now with Kindle. And then when the paperback version is available, you can actually switch that over. There's no issue with that. So you guys can check that out as well. All right, here we go. Question number 11. All right. The client suffers an amputation of the first and second digit in a chainsaw accident. Which task should be delegated to the LPN or LVN? All right. So this is all about understanding the scope of practice. LVNs, you need to know what you can and can't do and what you can and cannot accept. All right. You need to know what you can and can't do and what you can and cannot accept. RNs, you need to know what their scope of practice is. All right. So can an LPN cleanse the amputated digits and place them directly in ice on an ice slurry? Can they wrap the cleansed digits in saline moist gauze, sealing it in a plastic container and placing it in icy water? Can they gently cleanse the amputated digits and the hand with providone iodine? Or can they cleanse the digits with sterile normal saline and place it in a sterile cup with normal saline, sterile normal saline? What are we thinking? Man, those are tongue twisters. What are we thinking? Iodine is a no. Okay, well, there's that then. There's that. All right, we got some D's. We got some B's. Bridget says B. B for Bridget. All right, what else are we thinking, y'all? Hey, if you guys are new here, welcome. Hey, we're on the road to 20,000 likes, y'all. We're on the road to 20,000 likes. If I don't get to 20,000 likes by the time I get to question, we'll say 15. We don't get to 20,000 likes by the time I get to question 15. My throat hurt on some Monique-ish. Here we go. And the answer is B. Wrapping the cleansed digit in saline moist gauze, sealing it in a plastic container and placing it in icy water. Once a finger amputation has occurred, ischemic tolerance times are 12 hours if warm and up to 24 hours if cold. For a more proximal amputation, these times are halved. The amputation part should be covered in a normal saline-soaked gauze, sealed in a plastic bag, and submerged in icy water with no direct contact to the ice. If there is direct contact to the ice, it could result in tissue damage and render the amputation part not viable. All right. So shout out to everybody that got that question right. This is part of the emergency nursing and triage. All right. So make sure you guys, if you guys don't understand that, hey, circle back. Circle back, get the content, get your questions, and keep doing your rationales. Hey, I call that the 360, right? You got to get it all. All right, here we go. Question number 12. A client arrives in the emergency unit and reports that a concentrated household cleaner was splashed in both eyes. Which of the following nursing actions is a priority? Is a priority. Best nursing here, MA, depends on you. Is it Layla? It depends on you. Do you want to be a medical assistant? A lot of people have been medical assistants for 2 decades and they love it. So it's all you. Is it A, examine the client's visual acuity, patch the eye, use Restasis or an allergen drops in the eyes, or flush the eyes repeatedly with sterile normal saline? What are we thinking? All right, got a bunch of people screaming D at me. I think I seen one A in there. Got another A. Okay. Hey, if you guys are new here, make sure you guys like, share, and follow. Also, I want to know who you are, where you're from, and where you're at in your nursing journey. Where are you in your nursing journey? All right, I'll give you guys 10 more seconds. All right, what are we thinking? All right, here we go. Here's our answer. Graduated May, that's what I'm talking about. And the answer is D. Flush the eyes repeatedly using sterile, normal saline. Initial emergency action during a chemical splash to the eye includes immediate continuous irrigation of the affected eye with normal saline. Immediate irrigation with copious amounts of an isotonic solution, as described previously, is the mainstay for the treatment of or for chemical burns. Never use any substance to neutralize chemical exposure, as the exothermic reaction can lead to secondary thermal injuries. All right. That is also part of management of care, as well as part of the physiological adaptation, which falls under the medical emergency aspect, which is what we're talking about, which is emergency nursing. So shout out to everybody that got that question right. Anton, appreciate the heart puffs. Appreciate the heart puffs. Thank you. Thank you. Thank you. Gifts are not mandatory, but they are 100% appreciated. So thank you so much. I appreciate that. It says, I'm currently taking a break from my ASN program because I was struggling. That's okay, Laura. Hey, take care of what you need to do mentally for yourself. Failed once, so scared to retake. The anxiety for me. Grace, thank you for the friendship. Appreciate you. So Simone, are you going to allow an exam that has no emotional ties to you whatsoever to defeat you? I'm just asking you a question. Lana from the UK as a nurse for 7 years in acute medicine. Shout out to you, Lana. Let me know if you know where that's from. Question number 13. A 5-year-old client was admitted to the emergency unit due to the ingestion of an unknown amount of chewable vitamins for children at an unknown time. Upon assessment, the child is alert with no symptoms. Which of the following information should be reported to the physician immediately? All right. Is it the child was nauseated and vomited once at home? The child has been treated several times for toxic substance ingestion. The vitamin that was ingested contains iron, if you're from Baltimore, or iron, if you're not. Or is it D, the child has been treated multiple times for injuries caused by accidents? What are we thinking? What are we thinking? Shout out to all 250 y'all. We're doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. All right. Free sets of questions. Make sure you guys go over there and check those out for yourself. Hey, if you're in nursing school right now and you haven't shared this with your cohort or with Cahoots or whatever craziness that you guys are a part of now, if you haven't shared them, you're wrong. And I'm going to need for you to fix yourself. So go ahead and do that. All right. Because, hey, don't be out here being greedy. There's plenty of Nurse Daddy K to go around. You know what I'm saying? All right, I'm done. I'm sorry. Here we go. And the answer is C. The vitamin that was ingested contains iron. Ice cream. Anton, appreciate the ice cream. Thank you. Appreciate it. Iron is a toxic substance that can lead to massive hemorrhage, shock, coma, and kidney failure. Iron poisoning is one of the most common toxic ingestions and one of the most deadly among children. Failure to diagnose and treat iron poisoning can have serious consequences, including multi-organ failure and death. All right. Once again, that's another one that's part of physiological adaptation that falls under emergency medicine. All right. So be very aware. And if you don't understand it, you got to circle back and get the content. All right. Circle back, get the content. You need content, Q&A. You need the rationales. That's the bare minimum of what you need. In my humble opinion, when it comes to studying for the NCLEX. I don't care what nobody tells you. There's no tricks to this shit. It's called putting in the work. You know what I'm saying? Just letting y'all know. Here we go. Question number 14. The following clients comes to the emergency department complaining of an acute abdominal pain. Prioritize them by for care in order of the severity of the condition. So you have 5 patients here. And now I need you to put them in order based off of the worst patient, the one that you need to see first, to the one that you need to see last. I passed my NCLEX last week. Thank you for your live. Is it Gambiana? Appreciate you. Appreciate you. Welcome to the greatest shit show on earth, known as being a nurse. All right. If there's a piece of advice that you could give with regards to the NCLEX, what would it be that you could give to everybody? Once again, congratulations to you. You're like number 3 or number 4 tonight. So shout out to everybody that's taking their NCLEX, RN or LPN, and you're out here, about to, acquire the title nurse. Your hard work is paying off. All right. All right. Hey, so you got to put them in order. It's not just one letter. You got to put them in order. There we go. DCBAE, DCABE. Start contributing to your 401k immediately. That's cool. I don't have a 401k anymore. No, I take that back. I do have a 401k. But it's not a 401k. It's what I call it's what's called a self-directed IRA or a self-directed 401k. So instead of it going into the stock market, I put it into real estate, like an apartment complex, and I just make money off of that. Or that's my retirement money works off of that. So doesn't always have to be that through your company. Just saying. Here we go. Here's our answer. Here is our answer. Oh hell yeah, that's what I'm saying. Pink Waco, we know what's up. And the answer is A, D, B, C, E. All right, there it is. All right, so the client with a pulsating mass has an abdominal aneurysm that may rupture and he may decompensate easily. An abdominal aneurysm is a life-threatening condition that requires monitoring or treatment depending on the size of the aneurysm. All right. So the lady with the left lower quadrant is at risk for life-threatening ectopic pregnancy. An ectopic pregnancy occurs when fetal tissue implants outside of the uterus or attaches to an abnormal or scarred portion of the uterus. Ectopic pregnancies carry high rates of morbidity and mortality if not recognized and treated promptly. A 15-year-old needs evaluation to rule out appendicitis. All right, needs to rule out appendicitis. All right, the fourth one is evaluation for gallbladder. And the last 3 would be epigastric pain, suffering from ulcers. This doesn't even look right. This is probably out of order. Yeah, y'all are telling me that it's out of order. Yeah, it's out of order. It's out of order. But y'all know number 1 is definitely the aortic aneurysm. It's all good. Hey, let me tell you something right now. When you guys are studying, it doesn't matter what review that you're using. It could be Archer, it could be UWorld, Kaplan, it could be whatever. They're going to have ones that are in there that are messed up. All right. So you take it for what it is. You take it with a grain of salt. You recognize it in that order. Miss G, appreciate you for the friendships. Thank you. So make sure you guys pay attention to that. So that one was kind of out of order, but the very first one, of course, is the one we want to look at is the abdominal aortic aneurysm. Okay. With signs and symptoms of heat-related illnesses. Which of them needs to be attended first? So this is not select all, apply, or put in order, so you give me one. All right, is it a relatively healthy home worker who reports that the air conditioner has been broken for days and who has manifested fatigue, hypotension, tachypnea, and profuse sweating? An elderly person who complains of dizziness and syncope after standing in the sun for several hours to view a parade? Is it a homeless person who is a poor historian, has altered mental status, poor muscle coordination, and heat, dry, ashen skin, and whose duration of heat exposure is unknown? Or is it a marathon runner who complains of severe leg cramps and nausea and manifests weakness, pallor, diaphoresis, and tachycardia? What are we thinking? I know that was long and it was long-winded. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Y'all got me to 20,000 likes, and I love it. I love it. I appreciate y'all. Go ahead and give me the 30, though. Go ahead. Go ahead and make that happen. All right, but here we go, y'all. Here we go. C, because neurological involvement. One thing I know is that if someone stops sweating, that's not good. That is true. That is true. We don't want them to stop sweating. That is a thermal regulator within the body to cool the body down, right? Here we go. Here's our answer in 3, 2. And the answer is C, a homeless person who is a poor historian, has an altered mental status, poor muscle coordination, and and hot, dry, ashen skin, and whose duration of the heat exposure is unknown. The signs and symptoms manifested by the homeless person indicates that a heat stroke is happening, a medical emergency, which can lead to brain damage. Hence the fact that they said altered mental status. And his heat exposure is also unknown. There's nothing that is good about anything that's said in that answer, right? Ashen skin is the key. Altered mental status is also the key, right? And his heat exposure, also the key. Like the whole thing really are telling, all right? But definitely that dry and that ashen skin for sure. So shout out to everybody that got that right. That's part of emergency medicine, the medical emergencies, which is under physiological adaptation. All right. Also under management of care, because you need to know who you need to go see first. But ladies and gentlemen, I have an NCLEX course plus a community where I actually did a live lecture today where we're talking about psychosocial integrity, the things that you need to know for the NCLEX specifically. And you could be a part of that for $7. Yeah, that's $1 more than $6 and $1 less than $8. It's better than any venti drink that you get at Starbucks. Oh God, I said Starbucks. Anyways, you guys can go over there and check that out, thebootnurse.com/special. You can join for $7. And if you don't like it, it's under a subscription. You can cancel at any time. So you guys go over there and check that out. Hey, like I said, there is over 70 videos that are in there right now, and there's 2 NCLEX reviews that are in there right now. So if you guys are looking for that, go check the link out right there, as well as go to my link tree. It'll be in there as well, and it's labeled the 7-day NCLEX course, or join the 7-day NCLEX course for $7. All right, here we go. Question number 16. An anxious female. The anxious female client complains of chest tightness, tingling sensation, and palpitation. Deep, rapid breathing, and carpal spasms are noted. Which of the following priority actions should the nurse do first? All right. So this is a prioritization question, right? So based off of all the information that's given to us in our question, what is priority? What is the very first thing that we should do? Provide oxygen therapy, notify the provider. Is it administer anoxylic medications as ordered, or have the patient breathe into a brown paper bag? And remember, these questions can be written in every which way. Don't get hung up on the fact that it may be too easy for you. Just shut up and answer the question. There you go. Everybody's telling me A. I got some D's on there. Throw some D's on it. All right. I'm going to give you guys 10 more seconds. 10 more seconds. We got A. Okay. All right, here we go, y'all. Let's figure out what the answer is. Let us figure out what the answer is in 3, 2, and the answer is D. Have the patient breathe into a brown paper bag. Now, I know a bunch of people are going to say, like, we don't do that anymore. Hey, according to the book, they still do it. According to the book, they still do it. All right. So just think about it. Ativan her up. That ain't even a need. All right. That ain't even it. That'd be funny though. The client is suffering from hyperventilation secondary to anxiety. The initial action is to let the client breathe into a paper bag that allows for the rebreathing of carbon dioxide. The idea behind breathing into a brown paper bag is that rebreathing exhaled air allows the body to put CO2 back into the blood, right? So they're losing CO2. There has to be that equivalent exchange between oxygen and CO2. If you don't have enough, your body's going to be like, hey, yo, what's going on here? I need a little bit of that back. All right. I need a little bit of that back. Right. So that's just like, if you think about it, it's just like with a COPDer, right? Somebody who has COPD. With somebody with COPD, do I want to just administer oxygen to them? No, I don't, because that actually could cause more harm than good because of the CO2 exchange. You see what I'm saying? The difference between NCLEX world and the real world. Yes, thank you. Right now, but think about it. If somebody is hyperventilating, do you want to put oxygen on them? They already have enough oxygen. They don't have enough CO2. You see what I'm saying? So that's where you really, really, really have to pay attention. You have to pay attention. All right. But shout out to everybody that got it right. And if you didn't get it right, circle back and understand why the answer is incorrect. All right. So shout out to y'all. There you go. Oh, my God. Hey, y'all, Jill is here. Chill out. All right. Chill out. No, hey, don't nobody act up. All right. We all got to be on our fucking P's and Q's because Jill is in here. Anyways. All the fun is out the door. Question 17. An intoxicated an intoxicated client comes to the emergency unit with uncooperative behavior, mild confusion, and slurred speech. The client is unable to provide a good history, but he verbalizes that he has been drinking a lot. Which of the following is a priority action of the nurse? Do I want to as the nurse, do I want to administer IV fluids or IV fluid incorporated with vitamin B as ordered? Do I want to administer naloxone or Narcan 4 milligrams as ordered? Contact the family to get information about the client or obtain an order for the determination of the blood alcohol level. What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. I got them off of nurseslabs.com. They are free sets of questions. Make sure you guys go over there and check those out for yourself. By the way, hey, make sure you guys like, share, follow, like the stream, share the stream. If you're in nursing school right now, I don't care who you hate. I don't care what Becky did to whomever. I'm going to need Becky to know that I'm out here for her. You know what I'm saying? And then you can let me know, in the DMs if Becky's, been acting a fool, and then we can check her later. You know what I'm saying? So, but hey, make sure you guys share. You're in nursing school. Shout out to you. Hey, I'm not saying it's never too early to learn NCLEX, but it's never too early to understand what NCLEX is about. Okay. You're on spring break. Must be nice, Johnny. But the answer is A, administer IV incorporated with vitamin B1 as ordered. The client has symptoms of alcohol abuse, and there is a risk for Wernicke's syndrome, which is caused by a deficiency in vitamin B1, or vitamin B thiamine deficiency, which is vitamin B1, is common in patients with alcohol dependency. Cognitive impairments may be an early consequence of thiamine deficiency. Wernicke's encephalopathy is underdiagnosed and undertreated. All right, thiamine. Anybody, hey, if you remember good old Mark Clement, what did he say? He was just like, they need vitamin B1. He was like, if you don't get B1, then you'll be one. And by that, he means a crazy. My reading is starting to pay off. I hope so. I really do. Because if you don't read the question all the way, the potential of you getting the question wrong is very, very high. So read the effing question. So shout out to everybody that got that question right. Here we go. Question number 18. Plus it said priority. It does say priority. Indeed it does. Here we go. Question number 18. The nurse is providing discharge instructions to a woman who has been treated for contusions and bruises due to domestic violence. I'm not going to say what I was going to say next. What is the priority intervention for this client? Why? Because domestic violence is not. Daddy Mark, stop it. He really is, though. Oh, here we go. A, is it A, arranging transportation to a safe house? Is it B, advising the client about contacting the police, making an appointment to follow up on the injuries, or making a referral to a counselor? What are we thinking? Not her over here calling him Daddy Mark. That's actually hilarious. What are we thinking, y'all? What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. I got them off nurseslabs.com. They're free sets of questions. Make sure you guys go over there and check those out for yourself. Also, if you're new here, I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse out here, what are you doing? Hey, we get a bunch of folks in here. We get some lab techs. Shout out to my respiratory therapist. I love y'all. Sugar just told me, hey, help me understand. Thank you. You're welcome. You're welcome. That's what I do. That's what I do. Hey, if you guys aren't following me on Instagram or any of those other social platforms, because, TikTok is being weird. Well, not TikTok, but the U.S. government's being weird with TikTok. You know what I'm saying? So make sure you guys go over there and follow me on all those other platforms as well. All right. But the answer is A, arranging transportation to a safe house. Safety is the priority for this client, and she should not return to the place where violence could occur. Make sure a safe environment is provided, offer shelter options, legal services, counseling, and facilitate such referrals. And then also with this, you'll get help from the social worker, so on and so forth. And so just be aware that you as the nurse has to maintain the safety aspect of this client. Okay. You're an MA and a phlebotomist. Shout out to you. Shout out to all my Hey, by the way, if I got my lab techs, phlebotomist, X-ray, OT, PT, pharmacy, not lab, because y'all always be messing with me, telling me that my shit's hemolyzed, and I didn't like that. But I'm just playing. But shout out to all y'all. I'm saying, and to let y'all know, without those ancillary services, we really can't do what we need to do for ourselves. You know what I'm saying? So, Like, everybody fucking love everybody. Hey, your egos need to be left at the fucking door. You know what I'm saying? Everybody love everybody. I'm just saying. Here we go. Question number 19. In the work setting, what is the primary responsibility of the nurse in preparation for disaster management that includes natural disasters and bioterrorism incidences? Is it A, being aware of the signs and symptoms of potential agents of bioterrorism? Is it B, making ethical decisions regarding exposing self to potentially lethal substances? Is it C, be aware of the agency's emergency response plan? Or is it D, be aware of what and how to report to the Center for Disease Control and Prevention? What are we thinking? Kathleen says, I've been a 30 years ICU nurse. Looks interesting. Like to keep up. Well, ma'am, I'm glad that you're here. I'm glad that you're here. You go ahead and you keep up. All right, what are we thinking? What are we thinking? Hey, so disaster preparedness is actually one of those things that's popped up recently, such as, hey, what do you do? We talked about a specific question earlier during the live stream. So you guys tell me which one it is. Tell me what you think. Duchess thinks it's C. C from the Philippines. Shout out to everybody in the Philippines. I'm trying to go there. I'm trying to go to the Philippines to visit. All of them wrong. You got to pick one. Shawnee tells me C. All right, here we go, y'all. Let's see what the answer is in 3, 2. And the answer is not all of them, so you would have got that question wrong. Anyways, but it's C. Be aware of the agency's emergency response plan. In disaster preparedness, the nurse should know the emergency response plan. This gives guidance that includes the roles of the team members, responsibilities, and mechanisms of reporting. Emergency preparedness encompasses diverse fields within the hospital and regional settings. Planning membership groups should address key aspects across these fields, including, but not limited to, public safety, facilities, logistics, pharmacy, transportation, clinical patient care, non-clinical patient care, media and public relations, communications, radiation, infection control, and administration. There's a lot that goes into emergency preparedness. All right, so think of I want to say it was in Libya or Lebanon, where there was a massive explosion that killed, I think, 260 plus people in the city. It was like a fertilizer, right? So, you got to think about, hey, what to do for those. Think about COVID. Think about COVID. That's another emergency response plan, right? You got explosions that are part of the emergency response plan, right? So there's all different types, and everybody has a role to play. Oh, by the way, Washington State. Shout out to Washington. It's rainy a lot. I feel like I'd be depressed, so I'll never go there. But you up there, so you must love it, Jennifer. Question 20. Michael works as a triage nurse, and 4 clients arrive at the emergency department at the same time. List the order in which he will assess these clients from first to last. So who is the priority? Who am I going to see first? All right. Is it an ambulatory dazed 25-year-old with a bandaged head wound, a 50-year-old with moderate abdominal pain and occasional vomiting, a 35-year-old jogger with a twisted ankle having a palpable pedal pulse and no deformities? Or is it an irritable infant with a fever, petechiae, and nuchal rigidity? What are we thinking? Let's see if Nurses Labs gets this one correct. Hey, we're on the road to 30,000 likes. Hey, get me there. Give me the 30,000 likes. Make it happen. Hey, make sure you guys share. Hey, if you haven't shared already, hey, I need like 100 shares. TikTok loves me when I get 100 shares. If you haven't shared it, I don't care if you have to share it to Mima. Mima need to be learning what's going on up in here too. You know what I'm saying? But let us see what the answer is, y'all. Here is our answer in 3, 2, and the answer is D, A, C, then B. Now, let us come to the agreement that the baby with potential meningitis would be number 1, right? The baby with potential meningitis would be number 1, right? Our second one, where it was displaying intracranial pressure, right? Which would have been A. What's up? Throw some D's on it. What's up, Alexis? Miss Ma'am, I see you out there. Hey, I know you're almost out of the Navy too, so don't think I don't be paying attention. All right. And then the third one, we're talking about moderate abdominal pain. Right. And then we have the ankle injury, which will be last. Right. You're out and free. That's what I'm talking about, girl. On the road to 100%. That's what I'm talking about. If you ain't been there yet, proud of you, man. Keep it up. Hey, you know me. That's how I do. Hey, ladies and gentlemen, if you're one of those individuals that had a hard time on the NCLEX, if you failed the NCLEX, you don't know where to start. you don't know how to get over the fear of this exam that has no type of emotional tie to you whatsoever, if you don't understand where to start with regards to your time management, accountability, hell, you get my phone number. If you're one of those individuals that needs help with your NCLEX, you can check me out at thebootnurse.com/coaching. Fill out everything that needs to be filled out and then schedule a call with me, and we can see if coaching is right for you. You can check that out right there at thebootnurse.com, or you can check it out. The link is also in my bio. All right, here we go. Question number 21. In conducting a primary survey on a trauma patient, which of the following is considered one of the priority elements of the primary survey? Is it brief neurological assessment, client's allergy history, initiation of pulse oximetry, or complete set of vital signs? What are we thinking? B. Okay. So remember, we're doing the primary survey. We're doing the primary survey. So primary, is that first? Is that second? Is that third? What are we thinking? Everybody's telling me D. We got D. Duchess says D. Is it Nave? Nav says D. Natty says first. Okay. Vitals. Okay. All right. A, B, C. It's easiest. 1, 2, 3. A, or I'll leave. Oh, say TikTok police officer. Don't tell me you're going to leave if you get it wrong. I hope you get it wrong. Oh my God. I'm sorry. I don't know what happened there. My bad. I'm just kidding. I hope you don't get it wrong. All right, here we go. Here's our answer, y'all. Here is our answer in 3, 2. And the answer is A. So you got it wrong. I'm just playing, but let's see why. Let us see why the answer is A. A brief neurological assessment to determine the level of consciousness and pupil reaction is part of the primary survey. Once the patient is stabilized, a neurological examination should be conducted. CT scan is the diagnostic modality of choice in the initial evaluation of patients with head trauma. That felt good. I'm glad that felt good. Hey, where'd TikTok police go? Hey, where you go? You still here? Did he leave? Samantha, I'm gonna need for you to find him. Let me know where he's at. Hey, I'm just playing. Hey, here's the thing. Everything is a learning process. Everything is a learning process. It doesn't matter if you get it wrong, if you get it right. I mean, I want you to get it right, but if you get it wrong, I want you to get it wrong here. That way you don't get it wrong on the exam when you go and you take it, okay? Samantha, see, I knew you were in here. Samantha, I made you a mod, by the way, so I'm just saying. You already know, you know what I want, and you know I don't play no games. Question number 22. A 65-year-old patient arrives at the triage area with complaints of diaphoresis, dizziness, and left-sided chest pain. This patient should be prioritized into which category? Is it non-urgent, urgent, emergent, or high urgent? There's a lot of urgents in there. A lot of urgents. Oh, shout out to all 230 y'all. We're doing NCLEX questions, both for RNs and LPNs. Welcome. If you guys are new here, a little bit about me. I've been a nurse for 3.5 years. I've worked ICU. Specifically, I've worked in a burn ICU and a medical ICU. I floated to neuro a few times, and I floated to med surge. I worked OR and PACU as well. I was in the Navy for 16 years. 9 out of those 16 years, I was a master instructor. So I've taught everything from a surgical technology program to trauma nurse. I'm a TNCC instructor, to pre-hospital trauma, to a whole bunch of other stuff. So I love being here. I love that y'all are here, get my teach on. So I appreciate y'all being here, getting y'all learn on. So, and the answer is C. It is emergent. Chest pain is considered an emergent priority, which is defined as potentially life-threatening. Yeah. If the nurse can accurately diagnose the client or diagnose the patient with these criteria and mark as a level 1 trauma patient, the patient will need immediate life-saving therapy. Immediate physician involvement in the care of the patient is critical and is one of the differences between level 1 and level 2 patient designations. All right. So a lot of people are saying that it could be angina, could be an MI. True, it could be. It's the left side. It's the diaphoresis and the left-sided pain that are like really big dead giveaways, right? So anytime you hear somebody complain about left side, it don't even matter what it is. They need to get checked out ASAP to make sure that they're not having an MI. All right. All right. Can you do GI? I have a GI test tomorrow. Hey, these are just random, and these are the emergency nursing ones, so I won't be doing any GI ones today. Here we go. Question number 23. You respond to a call for help from the emergency waiting room. There is an elderly patient lying on the floor. List the order for the actions that you must perform. Do you want to instruct the nursing assistant to get the emergency cart, establish unresponsiveness, perform the head tilt, or the chin lift or jaw. Y'all know what I'm talking about. It's the head tilt, chin lift, or the jaw thrust. Call for help and activate the code team or initiate CPR. What are we thinking? So now with this one again, you got to put it in order. What are we thinking? What are we thinking? Shout out to everybody out here rocking. We're doing NCLEX questions. I want to know who you are, where you're from, and where you were at in your nursing journey. If you're not following me on all those other social media platforms like Instagram or YouTube or anything like that, you guys can check. You can check me out at the Boot Nurse on Instagram and on YouTube. You'll find me over there. All right, brace. Simone says brace. All right, y'all. Here we go. Here's our answer. LPN preparing for a bridge program. Shout out to, is it Rita or is it Rita? Let me know. Let me know which one. Rita, number 1, Rita, number 2. All right. And the answer is A, C, D, B, E. There's your answer. A, C, D, B, E. Rita. Okay. I got you. I thought you were like, I'm a rider. I was like, oh, okay. You one of them? All right, ladies and gentlemen. Hey, so it's A, C, D, B, and E. You got them all wrong. That's okay. That's okay if you got them all wrong, because guess what you're going to do? You're going to circle back. You're going to read the rationale, understand why they're wrong, and then you're going to keep it pushing. We don't hold on to questions like that. We just take note. And when we take note and when it's time for us to get our study on, then we're going to do that. That's exactly what we're going to do. All right. So here we go. Question number 24. In caring for a victim of sexual assault. Wait, can I say that on live? We'll say essay. Which task is most appropriate for the LPN? All right, so LPNs, what can you do? RNs, what can they do? What's within their scope of practice? It was out of order? All right, well, we'll just omit that. I ain't going back. We'll just omit that. Me trying to sneak watch at work. Missed that. Nah, you good. It's all good. Don't worry about it. We'll omit that because it looked like it was out of order. And I believe y'all if that's what y'all are telling me. So, all right, I see you. I hear y'all. It's out of order. My goodness. So is it A, provide emotional support and supportive communication? Is it assess immediate emotional state and physical injuries? Ensure that the chain of custody is maintained. Collect hair samples, saliva swabs, and scrapings beneath the fingernails. Hold on. Who says something? D, or I will cry. Stop it. You're going to cry? Really? That's actually hilarious. Hey, so welcome to everybody's here. We're doing NCLEX questions. We're doing NCLEX questions from nurseslabs.com. Now, granted, they are free sets of questions, but as you guys can see, they're not always the greatest, but they do. They work. These lives work for people. These lives work for people. You want to know why? It's called being in a community. It better be A. Oh, gel. You know what? I hope it's not A, but let's find out. Oh, dang. You win this round, gel, but I want to provide emotional support and supportive communication. All right. So the LPN is able to listen and provide emotional support for her patient. The client is at the center of care. They're at the center of care. And the LPNs, y'all can do that. Y'all can do that. Let's go. That's what I'm talking about. All right. So remember, if you get it wrong, circle back, understand why you got it wrong, read your rationales, and then circle back, get the content, and keep doing your questions. That's how the flow goes. You got to get into the flow. All right. Olivia Benson would be so disappointed in me. Why, Kay? Why? Question 25. Following emergency endotracheal intubation, nurses must verify tube placement and secure the tube. List in order the steps that are required to perform this function. Now, let's see if this is in order. All right. Do I want to secure the tube in place? Ensure the breath sounds are equal and bilateral. Obtain an order for a chest x-ray to document the tube placement, or auscultate the chest during assisted ventilation. What are we thinking? Remember, we got to put them in order. We're going to see if this one's in order. Somebody said me, A through D in order. Yes, that's what it says. List in order the steps that are required to perform this function. It says, because I've watched Law and Order SUVs for 10 years. Stop it. It's in order. Sounds good to you? Cool. Too easy. All right, what are we thinking? Shout out to all 266 of y'all. Make sure you guys like, share, and follow. Hey, we need 30,000 likes, y'all. What are we doing? Y'all tired on this Wednesday? Usually it's Monday. That's what I meant, A through D. Oh, okay, I got you. I was like, what do you mean? All right, cool. No worries. Here we go. Here's our answer. Here's our answer in 3, 2. It's B, D, C, and A. Let us see. The rationale. Auscultating and confirming equal bilaterals should be performed in rapid succession if the sounds are not equal or if the sounds are not heard over secure the two with x-ray. Yeah, 1 and 2. After placing the endotracheal tube is essential to confirm its placement in the endotracheal tube or with the trachea. The physician should auscultate bilateral sounds and the absence of bilateral sounds over the stomach. Yeah, I don't like that one either. I don't like this one either. The post-intubation, the x-ray is the last thing that, oh no, not the x-ray. The securing of the tube is the last thing that you do. The x-ray is before that. So that would be C. And then B, which is confirm. Yep. Yeah, so that's right. B, C, B, D, C, A. That's right. There we go. It takes too long for x-ray. Look. Hey, a blessed Miss Mayhem. Hey, I'm telling you right now. Hey, if y'all are in nursing school right now, y'all see this young lady right here, a blessed RN. That lady does dosage calculations like you would not believe. She just hit her 14-year mark of being a nurse and runs circles around me when it comes to dosage calculation. So if y'all are not following this young lady right here, what are you doing? Y'all need to go follow her right now. And ladies and gentlemen, I have coached so many different people. This young man right here he's the last one who gave me a testimony. This is AJ. Now my man's working in CBICU. Now she's working ICU. She's doing peds. And I don't know exactly where Joy's working at. I got to ask her. But she out there doing great things. And she actually used my course. All of them used my course on top of helping with coaching. So if that's something that you guys need, you guys can check the coaching out still. It's in my link tree at thebootnurse.com/coaching. All right. So make sure you guys go over there and check that out for yourselves. Somebody said, what is her name? Go check it out. Go check it out. She does dosage calculations all the time. And I know Samantha be over there, but here we go. Question number 26. A 15-year-old client, male client, arrives to the emergency department. He is conscious, coherent, and ambulatory, but his shirt and pants are covered with blood. He and his hysterical friends are yelling and trying to explain that they were goofing around, and he got poked in the abdomen with a stick. Which of the following comments should be given first consideration? All right. The stick was really dirty and covered with mud. He pulled the stick out just now because it was hurting him. He's a diabetic. So he needs attention right away. There was a lot of blood, and we used 3 bandages. What are we thinking? What are we thinking? Shout out to all 200 plus of y'all. We're doing NCLEX questions. Y'all got me to 30,000 likes, so I appreciate y'all. What are we thinking? What are we thinking? Hey, and if you're new here, of course, I'll tell you again. Hey, I failed my NCLEX. If you're new here, and if nobody's ever told you that they failed their NCLEX, then hey, cool. I'll tell you right now. I failed my NCLEX 3 times, and no part of me cares about what any of y'all think about that. I'm telling you. Because you know who's never going to ask your job and your patient. Because that test does not dictate the type of nurse that you're going to be. Only you can determine what type of nurse that you're going to be once you start working. Sherry says, I failed 2 times. Cool. You failed 2 times. Did you pass afterwards? Hey, guess what? And I've been a nurse almost 4 years. You know what I'm saying? So get out of your own way. Get off of your beach. You know what I'm saying? Thank you. I needed to hear that today. Look, I'm letting y'all know right now. Hey, you failed it twice. Cool. So when are you taking it again? Chuck says, I failed 4 times and finally passed. That's what I'm talking about. I like people to come in here and to be vulnerable and to tell me the truth about themselves. You want to know why? Because that is the very first step into going to conquer it. It's the understanding that you have a problem, auditing yourself, and going forth with new direction. That's what it's about. But the answer is B. He pulled the stick out just now because it was hurting him. That's fair. That's not fair. Don't do that. Don't let them do that. An impaled object may be providing a tamponade effect, and removing can precipitate sudden hemodynamic decompensation. Right? Additional history, including a more definitive description of the blood loss, depth of penetration, and medical history, should be obtained. All right. So understand that. All right. It essentially creates that back pressure type of issue. And once you pull it out, boom, everything's just going to leak out all over the place. All right. So that actually, a stick is actually keeping him alive. So I've actually worked ICU and I saw a lady get impaled. I have no idea how this happened, but she got impaled by a whole 2x4 in her chest. And I'm like, Lord, give me the strength. Right. So just be aware of that. And they didn't take it out. They had to keep it there until she got to surgery to make sure that she was stable enough to take that thing out. All right. So be aware of that. All right. Here we go. Question number 27. A prisoner with a known history of alcohol abuse has been in police custody for 48 hours. Initially, anxiety, sweating, and tremors were noted. Now, disorientation, hallucinations, and hyperactivity are observed. The medical diagnosis is delirium tremens. What is the priority nursing diagnosis? Is it risk for injury related to seizures, risk for situational low self-esteem related to police custody? That's probably it, right? Is it C, risk for nutritional deficit related to chronic alcohol abuse, or is it risk for other direct violence related to hallucinations? What are we thinking? What are we thinking, y'all? What are we thinking? A. Everybody's telling me A. Nicole, thank you for the follow. When everyone says A, but I think D. Hey, don't go off of what they're saying. Go off of what you think, because you're not taking your exam with everybody else. You see what I'm saying? I see everybody seeing D. I'm gonna say the old thing. You see everybody jumping off a bridge, you're gonna do it. I know that's played out, but whatever. You know what I'm talking about. Here we go, y'all. Here's our answer in 3, 2. And the answer is A. It's the risk for injury related to seizures. The client shows neurologic hyperactivity and is on the verge of a seizure. That's what delirium tremens can lead to. All right. Seizures can reoccur, though rarely leading to status epilepticus. Uncharacteristic signs of seizure activity should warrant further workup. Patient safety is the priority. All right. So patients need like Librium to decrease neurologic irritability and phenytoin or Dilantin for seizures. Thiamine and Haldol will also be ordered to address other problems that go on with the patient. Hey, I'm telling you right now, I have worked with so many patients that have had alcohol withdrawals and delirium tremens. Ativan and Haldol. You already know what the deal is. There you go. Follow your instinct. There you go. Hey, go with your gut feeling, because 9 times out of 10, the first answer is your correct answer. Okay. Question 28. In relation to submersion injuries, which task is most appropriate to delegate to the LPN, LVN? All right. So scope of practice. What can they do and what can they not do? Can the LPN stabilize the cervical spine for an unconscious drowning victim? Can they talk to a community group about water safety injuries or issues? I'm sorry. Can they monitor an asymptomatic near drowning victim? Or can they remove wet clothing and cover the client with a warm blanket? Now, understand you have RN, LPN, and UAP. You'd never want to give the RN a task that the UAP can do. All right. You got to remember is that as LPNs, you guys have more scope of practice than the UAP can do. All right. So think about those things. You pass what? You pass the question? I don't know what that means. Shout out to all 264 y'all. We're doing NCLEX questions off of nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. Hey, I need for you guys to like the stream, share, and follow, mostly because you love me out here. You know what I'm saying? So, see what we got going on. Everybody's telling me we got some C's. Okay. We got some D's. Nurse Apple, thank you for the share. Appreciate you. C, D can be delegated. Okay. Okay. All right, here we go, y'all. Let's see. There are a bunch of people that are saying D. Gabriella, give me one. You got to give me one. Liz, thank you for the roses. I appreciate you. All right, let's see. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is C. Monitor an oh my God, symptomatic. Oh my God, an asymptomatic near drowning victim. A asymptomatic patient is currently stable, but should be observed for delayed pulmonary edema, cerebral edema, or pneumonia. Appropriate decisions relating to the successful assignment of care or accurately based on the needs of the patient, the skills of the staff position description or job description, the employing facilities, policies and procedures, and legal aspects of care, such as a state legal scope of practice for nurses, nursing assistants, and other members of the nursing team. So this very well follows under the scope of practice. Why asymptomatic? That says that they're stable. I'll say S. That ain't even it. What do you mean? Gabriella. Oh my God, I cannot with you. So, ladies and gentlemen, that's understanding the scope of practice. Understanding the scope of practice, right? So the LVN can monitor, but not the nursing process. So you got, based off of the question, is like, what can they do? They can monitor. And the reason why they can monitor is because this patient is stable. The patient is stable. Can an LP and LVN monitor stable patients? Absolutely. Those are the ones that you have to take care of. They take care of stable patients. And they did not say the initial assessment. You see what I'm saying? They did not say anything about it being the initial assessment. The initial assessment has already been done because it said that the patient, you're monitoring an asymptomatic patient. Does that make sense? Okay, great. That makes sense. Awesome. I like Tia. I'm glad you're picking up what I'm putting down. Question 29. You are assessing a patient who has sustained a cat bite to the left hand. The cat is up to date on his immunizations. The date of the patient's last tetanus shot is unknown. Which of the following is the priority nursing diagnosis? All right, is it impaired skin integrity related to puncture wound, ineffective health maintenance related to immunization status, risk for infection related to organisms specific to a cat bite, or risk for impaired mobility related to potential tendon damage? What are we thinking? Everybody's telling me C. All right, cool. What else are we thinking? Hey, if you're new here, welcome. I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? What are we thinking? Is it Nayeli or Nayeli? Did I say that right? Yeah, Nayeli. Hopefully I said that right. Thank you for the follow. Appreciate the follow. Here we go, y'all. Here's our answer. Here is our answer in 3, 2. I'm a pre-nursing student, a soon-to-be nursing student, soon-to-be nurse. Speak it all into existence. I'm going to be an RN. I know that's right. And the answer is C. Risk for infection related to organisms specific to cat bites. Cat mouths contain virulent organisms or virulent organism. Was it a Pasteurella, Malta, whatever, bro? You already know what it is. It can lead to bacteremia and septic arthritis. Infections resulting from bites of all animals are polymicrobial with aerobic and anaerobic bacteria. Cats and dogs have an oral flora of, Pasteurella, staph, and strep most commonly. In cat bites and scratches, Bactinella infections are an additional concern. Hey, I'm letting y'all know, sometimes I don't know how to say these words. No part of me cares what you think. Fun fact, I had a cat scratch. Fun fact, I had a cat scratch fever as a kid. Oh, Lord. Your parents were just like, oh, you'll get better. Oh, my goodness. So shout out to everybody that got that question right. The answer, of course, was C. If you don't understand that, circle back, get the content, keep doing your questions and answers, and then do your rationales. All right, here we go, y'all. Question number 30. A 33-year-old patient with a history of seizures and medication compliance of Dilantin and carbamazepine is brought to the ED by the MS personnel for repetitive seizure activity that have started 45 minutes prior to arrival. You anticipate that the physician will order which drug for status epilepticus? Is it phenytoid and carbamazepine PO, carbamazepine IB, mag sulfate IV, or Ativan? Ativan or a lorazepam. You'll see lorazepam on NCLEX. They will use generic names on NCLEX and not trade names. All right? Because, NCLEX don't get paid for Ativan. You know what I'm saying? You meant D? You sure? Perfect wifey? You sure? I don't know. These questions are not included in the 7-day NCLEX course. And I don't have a Q. If you're asking if I have a Q bank, okay, perfect, wifey, I got you. And if you're asking if I have a Q bank inside of the 7-day NCLEX course, I do not. It's full of content. But my NCLEX reviews, like my NCLEX review where I go through management, all 8 sections of the NCLEX pie, as well as a 100-question new generation NCLEX review. I go through questions and answers. We break them down, read the rationales, understanding what the question is asking you, that type of stuff. But the answer is D. It is lorazepam or Ativan, whatever. How do I do the 7-day review? You can check the link out in my bio, the link tree. And you see where it says join the 7-day NCLEX course for $7. You guys can check that out. But IV lorazepam is a drug of choice for status epilepticus, right? Benzodiazepines and the anti-epileptic drug of choice for emergent control. Lorazepam is preferred because of its rapid onset of action and is dosed at 0.1 milligrams per kilogram IV. No more than 2 milligrams should be administered per minute. All right, so shout out to everybody that got that question correct. All right, I've literally been in the operating room and I've had patients that have had seizures. Next thing you know, hey, need that Ativan. Boom, pop them right out of it. Pop them right out of it. All right. So shout out to everybody that got that question right. And ladies and gentlemen, of course, please check out everything that I have going on. Right. So you guys can go over there and get you a free download over there at thebootnurse.com/test. I also have an ebook over 700 pages where we do EKG interpretations. We have pharmacology that's on there, management and delegation questions, so on and so forth. You guys can check that out at thebootnurse.com/victory. Of course, the 7-day NCLEX course is thebootnurse.com/special. You can join right now for $7. $7, all right? And then, of course, if you're one of those individuals that wants one-on-one help, mentorship, guidance on how to start and how to conquer your NCLEX, you guys can check me out at thebootnurse.com/coaching. You can check me out over there at the coaching, or you can find the link tree in there. It'll say NCLEX coaching and mentoring. But ladies and gentlemen, that is a wrap. I appreciate everybody for participating today. We did an hour, 18 minutes, y'all. Hour, 18 minutes of some thoroughly nice questions. Is the HESI way harder than the NCLEX? The HESI is trash. I had the HESI in school and I fucking hated it. And so I'll tell you, I don't like it. That's just me, though. You're welcome for the review, Tash. You're welcome. Shout out to everybody. Like I said, I got these questions off of nurseslabs.com. They're free sets of questions. You guys can check those out for yourself. But the HESI is way harder. But the HESI, I didn't like it. My school had HESI, and HESI did not help me not one fucking bit throughout the whole program. It was fucking trash. Like I said, check out the 7-day NCLEX course. That link is in my bio, as well as it's right there at thebootnurse.com/special. Get that free download. Of course, I have a book that's coming out called Conquer It. That link is also in my bio. As well as if you need help with coaching, you want one-on-one. Hey, with the one-on-ones, you even get my phone number. You know what I'm saying? So you guys can check that out at thebootnurse.com/coaching. And that, ladies and gentlemen, hey, I'm going to answer some questions. Hey, how y'all doing? Y'all all right? Cool. Today is Wednesday, y'all. Today is Wednesday. So, of course, if you guys are new here, we just wrapped up doing some NCLEX questions. I'm Kevin, your gracious host. Make sure you guys smash that like button, you guys share, and you guys follow. Although all these sessions will end up on YouTube at some point, so you guys can go over, go to my main page, check the YouTube, tap on it, it'll take you directly to my page, or everything is at the Boot Nurse. So at the Boot Nurse will take you there as well. But yeah, what questions do you guys have about nursing, about NCLEX, about anything like that? I'm gonna sit here and answer a couple of questions before I get off here. Good night from Kenya. Good night to you. What does that say? Another form of testing is supposed to be similar to NCLEX. It depends. Which one did you say? Do you record your? Yes, I do record my sessions. I answer that question. Do you help with HESI pharmacology too? No, I don't do anything necessarily with HESI. I just do I have pharmacology lectures. If that answers your question, is it Neve or Nave? UWorld or Archer? I personally liked Archer. That's just me. I didn't like UWorld. I didn't like UWorld at all. It just at the time I didn't know how to utilize UWorld. Hindsight's 2020. Now I'm just like whatever. But I like Archer. Do new nurses need internship programs? No, they don't need internship programs. However, if you are in nursing school and you get to be part of an internship, it's actually great because it helps you build a rapport with the place that you're working or you're potentially going to work at, as well as, you gain the experience. I'm talking about the Hearst test. Oh, I don't know. I tried to use Herson. I tried to use Herson. It was a long time ago. It did not work for me at all. Are you an ER nurse? No. I worked ICU, OR, and PACU. Do you have any tips to prepare for the HESI? I don't know which one. Which one are you talking about? Are you talking about the entrance HESI? Are you talking about the exit HESI? Are you talking about the HESI like in regards to in regards to like the end of your semester? Like I don't know exactly. Perfect. I've been using Archer. So here's the thing. I'm going to tell you right now is that it doesn't matter what you use. Like you can use my stuff, you can use Archer, you can use Hearst, you can use UWorld, you can use Kaplan, you can use whatever. If you don't know how to utilize the tool, it's not. It doesn't matter. It doesn't matter what it is. It's not going to help you. You hate Hearst. It's okay. It's okay if you don't like Hearst. I just couldn't really. And it was an environmental barrier with me. That country accent that Aunt Marlene has, that she calls herself, I just couldn't get through it. I could not get through it. Archer Review is way better. So that depends. That depends. User 66. Some people don't like Archer's Review because it's too fucking long. It's really fucking long. But, to each their own. So Archer's working for you and Archer works for a lot of people. How to buy RN? What are you talking about? How to buy RN? Pharmacology HESI. Nave, what exactly are you asking? So Kiki, what I would say for your exit HESI is to understand your management of care, which is a big one. Pharmacology is another one. And physiological adaptations, such as your emergency, your medical emergencies, right? Pathophysiology, the disease processes, and how you treat them. I took my exit HESI and failed. I've been there. I took an exit HESI and I failed too. Thank you. You're welcome, Queen. While we have to take it, it's 30% of our grade. Yeah, the HESI was 30% of my grade. You know what's crazy? I remember when I had like a 94 in one of my classes and I failed the HESI and I still passed and it dropped me like 10 points. It dropped me like a whole letter grade. It's actually fucking terrible. Someone who has active Archer, please assist. What are you talking about? I take my NCLEX P on Saturday. I'm super nervous. Daphne, if you've been preparing, you're gonna be fine, right? It would be not unethical, but for me to tell you to not be nervous is, that's wild for me to say. But here's what I will tell you is that you've been prepared, right? And you're gonna go there and you're gonna rock it. Speak it into existence. Don't go there with any negative connotations, any negative words, because believe it or not, what you say will come to fruition. So if you say fuck it, it is what it is, then fuck it. It is gonna be what it is. All right, and you will fail. All right. I'm a firm believer of speaking things out into the universe and then giving it back to you. Right. So speak it into the universe. All right. Susha, you're asking how to join, like to be a nurse. You like ATI? I can't really speak on ATI because I never used it. But for people that I've coached that use ATI, I'm not a big fan of it. It says no. The Hearst is 30%. Oh, so the Hearst is embedded into your program. So your Hearst is embedded into your program, just like mine had HESI, and other people have ATI. Some people have Kaplan. So yeah, I don't like that. I don't like that. I don't like that either, to be honest. But I've never had Hearst that was embedded into my program. So I really can't necessarily speak on that one, if that makes sense. But shout out to all 64 of y'all. What other questions do you guys have? Oh, Nave had asked, Naver, if you're still here, you were asking about pharmacology. So the best way to learn pharmacology is to understand what family the drugs fall under and then their suffixes. Because I'll give you an example. I'll use cardiac. So cardiac, under the cardiac medications, right? You have your ARBs, your ACE inhibitors, beta blockers, calcium channel blockers, digoxin, diuretics, antiplatelets and coags, nitrates or your nitroglycerin, and then understanding the last portion of what they are. So every beta blocker is an LOL and every LOL is a beta blocker. Now I need to understand what are the pharmacokinetics of that medication. Does it lower my blood pressure? Does it increase my blood pressure? Does it relax my vessels? Does it relax my vessels for afterload or for preload? Does it strengthen cardiac contractility? Like those are the things that you need to know. And then the safety implications, like before I give DIG, I need to always check an apical pulse. If it's less than 60, I hold it, stuff like that. So once you understanding that aspect of pharmacology. Okay. Where can a new nurse start from as a nurse? Duchess, you can start wherever you want. It depends on where do you want to go peds? Do you want to go, do you want to go to the ER? Do you want to go to the OR? Do you want to go to PACU? Do you want to go to, do you want to go to med surge? Like it all just depends on like where you want to go. And so you can go anywhere. It says, thank you so much. I'll definitely do that and keep positive. Absolutely, 100%. But Duchess, you essentially can start wherever you want. Now, certain places will say that, hey, we want to have a nurse that has at least a year of experience. So, that right there can kind of bottleneck you. But you essentially can go wherever you want. Everyone else will tell you go to med surge. You don't have to go to med surge. What would be the least stressful as a new nurse? Nothing. Nothing is least stressful because you go to med surge, it's going to have its own thing of stress. If you go to peds, own thing of stress. OR, ICU, tele, oncology, surgical, it doesn't matter. They all have their own portions of stress. But if you wanted to really think that the least stressful, in my opinion, for the fact that I work critical care, was a med surge floor. It was a med surge floor because of critical care. There's a bunch of stuff that we got going on, but med surge floor in regards to critical care is least stressful. However, they have their own level of stress. Not berating anybody that works med surge because, they get the work. Any advice for peds class? Understand that babies have higher numbers. Pre-op nurse 2 is least stressful. It depends. Like I can tell you right now, the pre-op area that I had, mostly it was stressful because they didn't have enough people. But then policies and consents, like doing the job is not hard. It's all the other stuff that was a headache. So, but pre-op has its own level of stress. I started in substance abuse and psych, and I love it. Brittany, I love that. I love that for you if that's where you'd like to be. Especially like you can go straight to psych and be in psych your whole aspect. You'd be as a nurse. A lot of people think that, oh, you're a nurse. Like not all nurses are built the same. Like as somebody who's former ICU and did all that other stuff, I'm not going to go to mental health and just be like, no, I got it. It's a total different ballgame. I was about to ask about psych nursing. Hey, look, she'll get you right. What about post-op or OR nursing? Post-op. So OR nursing has its own, so with OR nursing, it's one patient. So it's one patient, you as the nurse, right? You have a team full of people, but you deal with your own stressors, such as making sure the patient's consent is taken care of, making sure that the doctor is happy, making sure anesthesia is doing what they're supposed to be doing, monitoring your techs, making sure that you have all the equipment in your room, make sure your equipment works. If you have a rep for a specific type of instrument or implant or whatever, they need to be there. And then depending on what type of OR nurse that you are will depend on the other added stresses, like if you're part of the heart team or if you're part of the total joint team or if you're part of neurology or if you do ortho spine, like everything has their own aspect. Now with PACU, the biggest thing that you have to know is airway, right? Because you could be a PACU nurse taking care of two patients at the same time that have come from the operating room or from procedure. And airway is the biggest thing because they were intubated and they come with their own added stresses as well. But I wouldn't even think about it as being as less stressful. I'd be thinking about like, hey, where do I want to go and where can I start learning to control that stress? How do I join your class? Are you talking about the 7-day NCLEX course? So that's an on-demand course and you can check that link out up here in my, if you go to my main page where all of my videos are, hit the link. That's in my bio, and it'll take you to the 7-day NCLEX course, and you can join for $7. So what other questions do you guys have? I'm gonna hang out for a couple more minutes. I've been on here for an hour and a half already. So what other questions do you have? Is it Iada? Did I say your name? Iada? Thank you for the roses. I appreciate you. Hey, if you guys are new here and just now joining, we did NCLEX questions. We do them every Monday, Wednesday, Friday at 5:30. Central Standard Time and here in the good old US of A, specifically in Texas. IATA, man, yes, I said it right. So tips for the HESI entrance assessment. I could recommend 2 books. One was called the Trivium book, but I don't know if it's called that, or you can look up a Yellow Mometrics book. And honestly, you just need to break that book open, study it for like a good 3 to 4 weeks uninterrupted, and you'll be fine. I failed my first entrance exam. Hey, y'all, I'm just a walking bundle of failure to success. I failed my first HESI entrance exam, did it like 2 or 3 weeks later, and then I killed it. You know what I'm saying? So it be like that. So, but that's what I would recommend. The yellow Mometrics book, you can get it off. You can get it off Amazon. It's like $30, something like that. Perfect wifey. Give me some pediatric questions. I have my midterm tomorrow. First of all, ma'am, I will not give you anything. It's not how that works. It's not how that works. Now, if you ask nicely, then maybe I can give you pediatric questions on Friday, just to be petty, since you have a midterm tomorrow. How about that? How about that? How about that? Oh, y'all are funny. Y'all are funny. I'm just playing, perfect wifey, but we are not doing any more questions today. So sorry. But hey girl, go out there. Hey, go out there and kill. Go out there and kill your pediatric exam. You funny? Look, some people here on TikTok be wild. I ain't talking about her. Like, that's tamed. That's nothing bad. I've had people come over here and tell me that I'm a fraud, and I'm just like, oh, say it isn't so. Like, people wild out here. TikTok really gives people a way to have a voice when they shouldn't, because people are just out of pocket. It says, do you mind suggesting what you use for your exit HESI RN? I just used I literally used the Saunders book. That's all I used. Because that book or whatever, what was it, Evolve or Elsevier, whatever that book was, that's all I used, because that's where all the information came from. So that's what I did. Hey, if you guys are new here, we did NCLEX questions. Y'all got me to 31,000 likes. I appreciate y'all. A little bit about me before I get off here. I've been a nurse for almost 4 years. I worked ICU, OR, and PACU, as well as I was in the Navy for 16 years. Last 16 years of my career has been as an instructor. I became a master instructor in the Navy, and I'm still an instructor here on the outside as well. And so, and I failed my NCLEX 3 times. 3. And no part of me cares about what any of y'all got to say about that. I've literally had people come up to me and said, I would never want you to be my nurse. I was like, well, shit, I hope you don't fucking die then, guy. Like, what do you mean? Don't ask me for fucking help. If you really that adamant about me not being your nurse, cool. But I didn't let that test define me at all. And neither should none of y'all when you go up and you take it for your first time, or even if you've taken it multiple times. All right. And is it Glam? You're welcome. What other questions do you guys have? We talked nursing, NCLEX questions. NCLEX questions are now done. If you guys are just joining, you missed it. What other questions? All right, cool. If y'all don't got any other questions, I'm a bounce, because I got some content I have to make for people that have my NCLEX course. All right. What is your biggest tip for taking the NCLEX? My biggest tip for taking the NCLEX is to understand that it is an exam that has no emotional ties to you, and that you can go and you can take that exam as many times as you need within reason, depending on what state that you're in. But my biggest thing is to get out of your own way. Like, don't let the fear of this exam stop you from progressing in the right direction that you're trying to go. And prepare for it. Know thy enemy. What is that? What is that from Art of War, right? Know thy enemy. I know everything I need to know about the NCLEX. I know that it's in a testing center. It's in a computer. They're going to make me do a biometric hand scan. Like, I know all of that. So know thy enemy. Know thy enemy and understand the content. Get you Q&A. Get you all that stuff and prepare. I'm going to need one-on-one review after I'm done with my course. IATA, if you want one-on-one coaching or anything like that, the link's in my bio. Make sure, for all 43 of y'all that are still rocking, make sure you guys go follow me on YouTube, as well as follow me on Instagram at The Boot Nurse. It's the same as everything across. You can Google at The Boot Nurse and I would pop up. So make sure you guys go over there, because we don't know what the state of TikTok is going to be, how they're going to shut it down or anything like that. So make sure you guys go over there and check that out. Do I have to be vaccinated to be a nurse in 2024? If you're in a nursing program, they could require you. And if you're getting into a nursing program, the nursing programs require you to have certain vaccines. Now, in 2024, there are certain vaccines that you have to have. But it all just depends on the institution. It all just depends on the institution. But there are vaccines that are no-goes. Like, as in, like, it doesn't matter what your religious creed is, like, you have to get them. I had to get my vaccines. Yep, you do. You have to get your vaccines in order to in order to go to nursing school. They don't give a shit about no exemptions at all. They don't care about your exemptions. They don't care about your religion. They don't care about, because guess what? Since you have a religious exemption and you don't want to get vaccinated, they're going to kick that ass out and they're going to bring another very willing person that didn't get into nursing school. They're going to bring them right into your place. So think about that. Have a good evening. Geraldine, you have a good evening as well. COVID, it depends. It depends. From what I've been hearing, a lot of them are still making it mandatory that you have to have a COVID vaccine. That's just what I've heard. I don't know now. I had to get you had to get your vaccine, start nursing school. Yep. All right. So with that, ladies and gentlemen, I appreciate you guys giving me the 32,000 likes. Last little unshameless plug, because I'm not shameful about everything that I have going on. Check out my link tree in my bio up here. Everything from a free download for 42-page free download, y'all. Y'all go over there and y'all get that. Also, you guys can check out the ebook over 700 pages, as well as Conquer It, which is coming out June 5th, which marks my 4-year anniversary. You guys can check out the 7-day NCLEX course that you can join right now for $7. You can join it for $7, get you some knowledge, right? And then, of course, after that, you guys can check out the NCLEX coaching and mentoring if you need or want one-on-one help in order to help you conquer the NCLEX, whether it's your first time or it's multiple attempts. All right. And that, ladies and gentlemen, of course, make sure you go follow me on YouTube and go follow me on Instagram, because we don't know what's going to happen with TikTok, right? You make me want to go into nursing, but then I go to work and I see ER pharmacy and I'm like, nah. Is it Annika or Anna? Yeah, Annika Nana 14. There's different aspects of nursing, and you being, I guess, in the ER, you know that, like, you can literally be a nurse and never touch a patient. You know, it all just depends on aspects of nursing that you want to be a part of. So it all just depends. It really, really depends on you, what type of nurse that you want to be. A lot of places want you to go work at a hospital, which I don't think is a bad idea, because it allows for you to get the, it allows for you to understand what it's like to be a nurse by doing nurse, like the traditional nurse things, like working bedside. So not necessarily a bad thing, but I understand where you're like, nah, forget all that. So, is it Iata? You're welcome, ma'am. And like I said, make sure you guys go check me out on all those social media platforms. I appreciate everybody here rocking with me while we did questions. But of course, I will see everybody on Friday.